Staff at clinics on the front lines of climate change say more training and planning is needed to combat the health risks of weather events as they grow more frequent and severe. WREL's climate change reporter Liz McLaughlin shows us how a North Carolina clinic was part of developing a national toolkit that aims to protect patients.
When severe weather strikes, patients can be cut off from crucial medications and life-saving care. Just some of the so-called climate shocks that a new program is aiming to minimize.
And these toolkits provide us with educational materials that we can utilize with our patients and help them better prepare for the impacts that we see with climate change.
Dr. Alexis Hodges works at the Community Care Clinic of Dare in Nags Head, one of the pilot clinics that helped to develop a climate resilience toolkit, newly launched nationwide to health centers that serve underinsured communities to prevent a growing number of climate-related health impacts.
And we're seeing lots of things with mold increasing our respiratory diseases. So we're seeing a lot of dehydration issues, and we're seeing their diabetes not well controlled or their blood pressure not well controlled because of those impacts.
Harvard and AmeriCares started the Toolkit project 3 years ago by surveying frontline clinics across the country and found that a majority of those clinics experienced some kind of extreme weather disruption, and less than a fifth of staff think their clinic is very resilient to climate change.
Very little has been done on preventing harm before disasters happen through clinical encounters. We can tell people, we can give advance notice to people at risk that it's going to be too hot out and give them a plan as to how to stay safe rather than waiting until they're sick in the hospital. And I think that piece is really critical.
With the first set of resources in the field, program developers say this year will be a beta test to make improvements and hopefully spur wider adoption and prevent negative health outcomes across our most vulnerable patient populations. Liz McLaughlin, WREL News.